welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan. Variable cuff size to affect the hypertension levels. A recent study that has been presented as an e-poster in the EPI Lifestyle reports that variable cuff size severely altered the blood pressure levels. The study that found that in people in whom a small adult cuff was appropriate, the systolic blood pressure readings were on average 3.6 mmHg lower when a regular adult size cuff was used, but the systolic readings were an average of 4.8 mmHg higher when a regular cuff was used in people who required a large adult cuff and 19.5 mmHg higher in those needing an extra large cuff based on their mid-arm circumference. This variation does provide a valuable insight to the use of appropriate cuff size during blood pressure measurement. Tranexamic acid administration to affect thromboembolic events and mortality in patients with traumatic injury. Tranexamic acid has been indicated for menorrhagia and bleeding in patients with hemophilia, but also it has been commonly administered for bleeding related to cardiac surgery, orthopedic surgery, and even traumatic injuries. A recent study has examined the association of tranexamic acid administration with mortality and thromboembolic events compared with no treatment or with placebo in patients who underwent traumatic injury in the literature. The findings published in the JAMA Network Open suggest that tranexamic acid may be beneficial in various patient populations, especially subjected to trauma. However, reasonable concerns about potential thromboembolic events with tranexamic acid still remain. Less antibiotic use in dentistry not linked to increase in endocarditis. Individuals with congenital heart disease, prosthetic heart valves, or previous endocarditis are at a higher risk of infection. Sweden is one among the few countries that has removed the dental health recommendation to give prophylactic antibiotics to people who are at higher risk of infection of the heart valves, the so-called infective endocarditis. Since the recommendation was removed in 2012, there has been no increase in this disease per se as published in the journal Clinical Infectious Diseases. The recommendation was supplemented in 2016 with an instruction to consider prophylactic antibiotic treatment if prescribed by the patient's doctor. However, it still remains unclear how this addition has influenced the prescription of antibiotics by dentists. Low meat and meat-free diets associated with lower overall cancer risk. Excessive consumption of meat and meat products is often associated with overconsumption of energy and fat, resulting in excess weight, obesity, and an increased risk of various chronic diseases such as cardiovascular disease and even type 2 diabetes. Eating meat 5 times or less per week is associated with a lower overall cancer risk. You heard it correct. This is according to a study published in the BMC Medicine. The researchers have found that the overall cancer risk was 2% lower among those who ate meat 5 times or less per week, 10% lower among those who ate fish but not meat, and 14% lower among vegetarians and vegans compared to those who ate meat more than 5 times per week. COVID vaccine effectiveness declines after 6 months without boosters. A study released in the Lancet Respiratory Medicine by Providence confirms the overall effectiveness of vaccines in preventing severe infection resulting in hospitalization from COVID-19, but it also shows a substantial decline in protection after 6 months. Completed by a team of clinicians and scientists in the Providence Research Network, the study did examine data from nearly 50,000 hospital admissions, finding that vaccines were 94% effective at preventing hospitalizations 50 to 100 days after receiving the shot, but the same thing fell to 80.4% 200 to 250 days later, with even more rapid declines after 250 days. Overall, the data does support the importance of vaccinations for protection against hospitalization and also clearly evidences the need to boost that protection after 200 days, particularly for patients who are aged 80 years and above, or those who have specific medical conditions that increase their risk of severe infections. So vaccinations is must for all. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.